Back to 9:30, Pam.
Mine just turned.
Alrighty, I will call the meeting of the Legislative Affairs and Government Operations Committee to order at 9:30 a.m. Roll call, please.
And please remember to state your location. Gershenson,
Here in Bloomfield Township.
Hogendorfer and Jackson are absent with notice. Loops, I can't hear you.
Here in Clawson, Michigan.
Thank you. Joliet,
Here in Waterford Township.
and Nelson.
Here and Waterford Township as well.
Madam Chair, you have a quorum.
Excellent, thank you. Let's all stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible,
With liberty, and justice for all.
Alrighty, next up, approval of the minutes from the January 6th Legislative Affairs and Government Operations Committee. Are there any corrections to the minutes of the previous meeting? Pam?
Madam Chair, just a point of order. They weren't ready yet, so they're not available on the packet to approve yet.
Okay, so we don't need a motion?
We will do that at the next meeting.
Excellent. Well, I appreciate that. Moving on then to our next item, approval of the agenda. I
I'll
know
make a
that
motion
we were,
To approve the agenda. Sorry.
before we approve the agenda, I do want to just make a little amendment to the agenda this morning. We will be able to get an update from Deputy Chambers in regards to the vaccines. So if there isn't any objection, I would like to approve the agenda as amended with item number 1 being an update in regards to the vaccines.
Approve the amended agenda.
Excellent. Motion by Commissioner Joliet, support by Commissioner Lubes. All those in favor signify by saying aye. Aye. Opposed? Motion carried. Next up, we'll move on to public comment. Is there anyone from the public who would like to address the committee?
Good morning. You currently have no in-person public comment. There is no one on the on-call line, and there are no written submissions.
Excellent. Thank you. Seeing none, I will close public comment. Next up, we have communications. We need a motion to receive and file item number A, Parks and Recreation Commission Saginaw Bay Watershed Initiative Network Grant. Motion by Commissioner Gershenson, support by Commissioner Lubes. Is there any discussion or questions on communication A? Commissioner Gershenson.
Thank you. I just wanted to clarify. So all the discussion we had regarding the rules, this is coming to us as an application to look at what this grant is for. And if we approve it, they go ahead and apply for it. Is that correct procedure?
Pam?
The applications, they just come as an informational thing. They don't need to be approved. We just receive and file them. And then when and if we get the money back, then we get an acceptance. That would be a resolution that you would approve.
Excellent. Melissa?
Yeah, sorry, I just wanted to clarify, Pam. I was talking to Tina from Fiscal this morning because we have another grant application that we're working on. And she was explaining to me that I think the new board rules indicate that if it's an application above $50,000, which this one is not, it's $25,000. But if it's an application now above $50,000, that it does need board approval before we actually apply. So I think in the future that will be a slight change.
Okay, that's why I was confused. So this one is for $25,000?
Yes, correct.
And I found, so Saginaw Bay watershed is actually in Oakland County in Springfield Township. Is that correct?
It is. That is correct. Yep. Part of the Shiawassee River Basin.
And can you just give me a city so I can picture it in my mind that it's near?
It's downtown Davisburg.
It's Davisburg. Okay.
Yeah. Just north of Springfield Oaks Golf Course.
Okay. Very good. Thank you. I appreciate that.
Any other discussion or questions on item A in the communications? Alrighty, thank you, Melissa. Seeing none. Okay, all those in favor signify by saying aye.
Aye.
Aye, opposed? Motion carried. Alrighty, moving now to our regular agenda. Do we have Deputy Chambers with us on the call?
Doesn't appear that she signed in yet, so maybe I could suggest you move on temporarily, set this aside temporarily and come back to it.
Okay. Commissioner Gershenson?
Madam Chair, I'm here. Lisa Brown is here, just so you know. Sorry.
Good morning, Lisa.
Thank you, Madam Chair. I just wanted a clarification on the agenda. So normally we get a summary of each item on the agenda, which we did get. And then there was an additional agenda summary that was sent out. So who does the one that's attached normally, and then who did this additional one? I'm just curious.
So I
And is this
believe,
something we should?
oh, I'm sorry, Commissioner Gershon said you cut out right at the end.
Is this something we should expect?
So I do know that given that the analyst that is working with the Legislative Affairs Committee is different than in previous years, what we're doing presently is I know we have Michael Andrews and Amy Aubrey working together with this committee. So in the beginning, I think it's helpful for not just new analysts coming in to help, kind of get an idea of what's going to come before the committee and what items we are going to have before us. But additionally, I think it's helpful for us as commissioners. Did you find it helpful, Commissioner Gershenson?
Oh, I did. I loved it. I thought it was great. I was just curious who in the administration does the original one. There were two. There was one that was, yeah.
Madam Chair, I could probably help in clarifying some of this.
Yeah.
If it's okay with you, Madam Chair Nelson.
Absolutely.
So yes, Commissioner Gershenson, we do typically will get the items submitted to us through SharePoint. That typical process comes through. The reviewing departments, which would be HR, Corp Counsel, and Fiscal Services, would then look at the items that are submitted onto our SharePoint site, correct any misinterpretations or any get it factually correct and 100% for the board to approve it. At which point, once their time is complete, the analyst for the board will then go in and perform their duties when in researching further any of the items. If there's any clarifying questions that come up upon their analysis, we will then reach out to the submitting departments. In this case, clerk, Parks and Rec, and other commissioners that might have resolutions before the committee. And then typically what you found in this case is that we had some other further questions that arose with our analysis, and we received those answers for those questions prior to the committee. We communicated this to Chair Nelson, and she requested of us that we kind of drafted in that supplemental summary report that you received and shared that with the other members. So that's why you saw that this time.
Well, thank you. I thought it was very helpful. I appreciate that.
It'll all kind of depend upon how much the analysts have some, I don't want to say free time because it's not so much free time, but if we have some extra time in our day to perform these duties, we will, and we'll try to update the chair and the members as best we can.
Madam Chair, I found it very, very helpful, especially coming in new, and it answered all the questions I'd had. I talked with Amy earlier, and it was very helpful. Thank you.
Good. Well, Michael and Amy, we appreciate your support and time that you've dedicated to that. So thank you so much. Seeing that, I believe we have Deputy Chambers here on the call with us. So we'll proceed with hearing our update on the vaccines. Good morning, Hillary.
Good morning. Good morning, everybody, and Happy New Year to those that I have not had an opportunity to speak to yet this year. And Commissioner Jolie, we very much look forward to working with you. So congratulations on your swearing in and beginning on the Board of Commissioners. So I just thank you so much for letting us join. I just wanted to, and I know Leanne Stafford is joining the meeting later this morning as well on the other committee. But I know that everybody is getting a lot of questions and reading a lot of the articles in the newspaper in terms of the vaccine supply and demand. And so I wanted to join and just give you kind of a brief update and see what suggestions or concerns or questions that you might have in addition. So not to go back over too much of the history, but I think you'll remember in terms of the updates that we've been providing, you know, that it was our intention to use the 5 drive-through sites that we had been using for testing to vaccinate residents. And they're nicely, you know, spread throughout the county. They keep our employees indoors as opposed to the outdoor testing sites we were using. They allow through kind of efficient driving through. They have parking lots so that we can monitor people who are waiting the 15 minutes after they receive their vaccine. And we're comfortable with that as an infrastructure. I was able to go to the Rochester Fire Station this weekend and, you know, very impressed with the professionalism of our staff and the systems that they have in place. We can vaccinate 500 people a day at a drive-through, you know, so with 5 sites, that would give us the ability to do 2,500 vaccines a day. The staff is more than happy and equipped and ready to do 7 days a week. So that was kind of the structure that we had in place, ready to go in terms of the distribution. You'll remember, you know, back in December, we all started with the notion of 1A, which is hospitals vaccinating their staff and you know, the most critical healthcare workers. And then we were doing the EMS workers. And we were, you know, planning to work our way through the 1A category. And so, you know, for us, that meant not only the EMS, but then moving to other healthcare folks that weren't covered by a hospital system. So we were beginning to do some outreach to those constituencies to let them know that they could get a vaccine through us. Also, I think unique to Oakland County, what that also entailed was a significant responsibility for some of our long-term care centers. I'm sure you've read, you know, in the national news about the federal contract with CVS and Walgreens for the nursing homes and the other licensed facilities. And that is underway. So folks have been matched with CVS or Walgreens in order to receive their vaccines at those facilities. But in Oakland County, there were 80 facilities that did not have a match with CVS or Walgreens. And because of the relationship that the health department has had with those entities, you know, through COVID, you know, going back to the beginning of the year when we were getting them PPE, I mean, we actually have a nurse assigned to each of these facilities. You know, we were going to be taking those facilities on as well. And so we started to schedule time with each of those facilities. It takes a little bit of preparation because they have to get waivers and they have to get ready to accept us. But we were and are, you know, going out to those sites and vaccinating their residents and workers. You know, our plan was to do, you know, 2 to 3 a week, and in addition to the drive-throughs. And so, you know, from the very beginning, the county has received 1950 doses a week. That's been our supply consistently. We don't always know what we're getting, and so there's been a little bit of frustration in terms of planning purposes and when it's coming, but just consistently we've gotten 1950. We've asked for more, And so this past week, you know, you have to ask for what you think you're going to be able to use the next week. And so, you know, last week we asked for 3,000 vaccines. Unfortunately, yesterday we got 975, and today we're expecting 975. So we are not receiving enough supply to accommodate the appointments that we have, and of course the demand that we're receiving. But I think you've seen that's kind of the case across the board, right? The hospital systems, other county health departments, nobody is getting enough vaccine to satisfy their demand. It got a little bit more complicated when the state made the decision to go to 1B, because then, you know, people over 65 and teachers and police officers, you know, were then becoming anxious to get their vaccines. And so, you know, we did, when we had appointments available, you know, we were taking appointments from that, at that point, a variety of constituencies, because given the governor's announcement, we didn't feel like we were in a position to prioritize. So when you saw the news from the drive-thrus yesterday, you see a smattering of deputy sheriffs, a smattering of healthcare people, and a smattering of teachers. So clearly in the appointments that we have available this week, you know, a variety of, and some over 65, a variety of people got through to our system. So in terms of the process, we did create an online scheduling system. So going forward, people will be able to get an appointment online and through the nurse on call system. We've scheduled appointments out through February 1st at the 3,000 level, you know, the very bare minimum that we were hoping and that we were going to be getting from the state. So right now through February 1st, with first doses and second doses, we have appointments scheduled for 3,000. Now that's a problem, right? When you only get 1,950. So this week we've had to kind of postpone 2 long-term care centers, and we also have to kind of moderate a little bit how quickly we're able to get to our own deputy sheriffs. And we're working closely with Under Sheriff McCabe to get those folks in as soon as possible. So just so you know, like, we are scheduled out through February at that 3,000 level. So it is kind of critical that we continue to that next week we get 3,000, because if we don't, we're going to have to scale back what we already have scheduled. And then, you know, we were planning on getting more, and that way would allow us to open up, you know, more appointments. The nice thing about the system that we're using is when you schedule your appointment, it also schedules your second one. So we can keep track of, like, you know, that next appointment that you need in 3 weeks. So that's kind of where we're at in terms of supply and demand. So we're going to do 2 things to kind of help alleviate the frustrations that people are feeling. One, and I have to really compliment our IT department, because they've been proactive in seeing concerns and seeking to address them. You'll notice when you go to the website, if you click on vaccine, it actually redirects you to oaklandcountyvaccine.com. So our website was getting unstable last week at oakgov.com because of all the traffic. And so they created a second website just so that the traffic will be separate for vaccines. So that's been an improvement. It'll also help us to be able to fill out that page, that website, instead of just having a page. We've started to indicate how many vaccines we have, how many we've put in arms, and how many appointments we have, and we'll continue to update that. That's where the online sign up will be when there's appointments available for online sign up. The second thing that IT did is over the weekend, they've stood up a new call center system. And so we hope to go live with that tomorrow. We're testing it today. It will dramatically, I think, as you know, their nurse on call system had been based on the older phone system. So it's never been ideal. I mean, it met our needs in testing, but it's just functionality. It's just very kind of old in terms of the queuing and the functions that it has. And then sometimes it rang busy, it would disconnect people. So we were having some issues with it last week. This new system, it will allow for callbacks. So you'll be able to press 1 if you want to get a callback, will be a nice function. It will allow us to moderate the queue a little bit more, and it will be kind of all online and, you know, be a computer-based. So we're looking forward. We think that will alleviate some of the concerns that you've heard from your constituents in terms of calling Nurse on Call. It'll be a new number. We'll redirect people to it, but please be on the lookout for that that tomorrow. The only other thing I would mention is the county executive has been reaching out to all the hospital systems. So we have been coordinating with them on who they're doing and who we're doing and what supply they're getting and what they're hearing from the state. And you've seen that some of them are starting to move to vaccinating those over 65 that are their patients. And so that is a feasible alternative for our Medicare patients. And so it's really important that they monitor their electronic records, or their like My Chart, I think it's called, for Beaumont. Everybody has a different name, because that's how they'll get notified about making an appointment. So we are encouraging, we have on our website, that residents should also keep in touch with their hospital system. I mean, the ultimate solution is not only more vaccine, but more people being the provider and administrating the vaccine. And so hopefully, that starts to become more available. The state indicated they had 900 providers signed up to administer vaccines, but those folks don't have vaccines yet. So hopefully in short order, those types of things get improved. I mean, right now, unfortunately, it's us and the hospitals giving out the vaccines, with the CVS and Walgreens dealing directly with the long-term care. So, I mean, that's just kind of some of the updates I wanted to mention to you. I mean, we know that you're hearing from your residents as well. So if there's any other questions or suggestions, I will mention one other thing, and Commissioner Kowal has talked about this. We are going to put a form on our website so people can register for a dose. And that way, we'll queue them up and we'll email them when there's appointments available in the order in which they filled out the supply. So the form. So we do hope that will be live, in the next days, and that may help alleviate some of the concern that people have. It'll allow them to sign up for an appointment as soon as it becomes available.
Commissioner Gershenson, followed by Commissioner Joliet.
Well, thank you for coming. Certainly, we all are getting quite a few questions. And I think the number one question I'm hearing is, why are we getting so little?
I think that's the $1 million question. I do not think that the doses are sitting on a shelf at the state level. I'm convinced of that in the last few days. I do believe the state is getting out the vaccines that they have. But a chart of distribution that I saw from the state, illustrated that this week, 54,000 vaccines have been sent to hospitals and 50,000 to county health departments. So that would mean that statewide, there are only 100,000 vaccines. And so I think there's some logjam above that is, and I don't know what that is. I mean, you've read where the incoming Biden administration is supportive of getting all the vaccines out the door, not holding back half, with the notion that those will be manufactured, that, everyone still needs to get 2 doses. Nobody is moving off of that, but it's like, could we speed up the first dose and then backfill it, with more manufacturing in time to get the second dose. So Marcia, unfortunately, I really am not 100% sure what to say. I don't think it's sitting in a warehouse at the state level, and then from there to the federal government and the manufacturer, I don't have an answer.
And are you saying there's going to be a new phone number that we're going to get tomorrow?
Yes.
And is there also, we're going to get a new website for people to sign up online, a new...
The website, if you click on the vaccine button on the oakgov.com, still tell people to go to oakgov.com. And then you'll notice when you click on vaccine, it just takes you to something. And if you look at the URL, it says oaklandcountyvaccine.com. That will be seamless for our constituents. send them to oakgov.com. They'll press on vaccine. They won't even really, they'll see, a new website. That won't impact them at all. The new number, it's possible that the old number will just transfer them, or it's possible they'll have to redial. They're still trying to figure that out. But we're going to change the number on the website, any brochure, anything that we're putting out, once it's live. And we're trying to figure out just not having people redial. Although I think the value of the new system is so much that if that is a requirement of shifting over to this new call center, then we'll go ahead and do that. But they're still trying to figure out if you called an old number, if you would just get transferred to the new number. But yes, we will send that out to you as soon as it's live.
Okay, because after the governor's announcement last week, people that called our Nurse on Call number were told if you're over 65 to call on January 13th, which is tomorrow.
Yes, that's why we're anxious to get this new call center stood up, because we were expecting, the 3,000 this week. And so we were expecting to be able to accommodate a few more appointments, but that did not come to pass. So we are expecting to get a flood of phone calls tomorrow that we will have to moderate.
Right. I just think we need to be prepared, because that's the date that many people were given to start calling. So I would imagine there's going to be quite a flood tomorrow.
Yes.
Commissioner Joliet?
Hi, Commissioner Kokendorfer had emailed me some questions he wanted me to ask, and you've answered most of them. Is there a regular schedule on which the county receives dosages? Like, for example, do you get them on Monday, or is it arbitrary?
No, it used to be Thursday, but now it appears like it is going to be Monday. And they have guaranteed us that they're going to do a little bit better job of maybe telling us on Friday what to expect on Monday. But that, I think they find out like Thursday what they're getting from the federal government, and then they're going to try to make the local distribution decision by Friday, let us know, and then we receive on Monday. Most people, when you read in the paper, they got their vaccines all yesterday, but today we got 975 yesterday, and we're expecting 975 today. So it is traditionally Monday.
Monday, okay.
And
And
I think it's going to be going forward traditionally Monday, Tuesday.
okay, perfect. And is there anybody else that gets the shipments of the vaccines other than health departments and hospitals right now?
The only other ones that get the shipment of vaccines from the state would be the CVS and Walgreens, who are matched with the long-term care facilities.
Okay, thank you.
Hillary, do we know if, do people pay for the vaccines at the CVS and Walgreens, or is it free?
The contract with the federal government for the long-term care facilities?
Yes.
I don't think that they pay for them. Now, whether there's a relationship with Medicare for an administrative fee and they're charging back Medicare, I don't know the answer to that. I think that there may be a little bit of a Medicare connection, but I'm not sure.
Excellent. And my last question is, are we prepared for administering the second dose?
Yeah, what's nice is that we make, like usually when you apply to the state for your numbers, you say first dose and second dose. So everybody is still regulating, making sure that we have enough for the second dose. And when you make an appointment with the county, the system automatically makes your second dose. So yes, we are keeping track of that, what we will need for the second dosages.
Is there any concern that there's going to be delays in receiving that second dose?
Well, I think that, when you watch the national news, there's a little bit of back and forth among healthcare experts that, potentially, getting everything out the door is a tiny little bit of a gamble. And then there's back and forth opinion about whether it's a gamble willing to take because you need to get the vaccine out the door, or whether there's caution about that. But, and to a certain extent, they're just pushing the issue down the pipeline in terms of us making sure that we have that second dose. But I do think that there's enough concern about the supply that we will probably see those doses, all first doses is coming out from the Biden administration. And he's pledged to use the Defense Production Act to get more vaccine in production or whatever it takes. So, yeah, that's something we're monitoring.
Excellent. Thank you. Commissioner Lubes?
I understand now with the new system that's coming in place, the website and the phone system, that would alleviate the problem for older people with rotary dial phones not being able to access the system. So is it starting tomorrow that somebody would be able to access it without someone who doesn't have the internet or a computer?
Right, absolutely, yes. Yeah, we hope to go live tomorrow. So, you know, nurse on call and being able to make an appointment by talking to someone, you know, that really still has to be an option for us. And so while the online system will help, you know, some folks, we understand that others need to be able to speak to someone to make the appointment, which is why we feel so strongly about getting that system a little bit stronger.
Thank you.
It's interesting, like even like a Beaumont is saying when they emailed out there, people like telling them, you know, they said, we're not taking calls at this point. And I'm like, well, that's a luxury. So yeah, I think it's, but we're trying to, we understand that a lot of people are going to have to call us to make an appointment.
Thank you.
Commissioner Gershenson.
I just want you to know that I've gotten several calls from people in my district offering their warehouses for distribution. I've gotten volunteers that want to help because people are frustrated and don't understand what the holdup is. And I have passed those connections on to Leanne Stafford.
Thank you. Also, I should have mentioned that Leanne and Tom Hardesty, we have gone out to Suburban Showplace and talk to them in case, you know, we do get a large amount of vaccine and we want to run we want to open up, you know, a place at the, someplace at the show place to offer to do vaccines out there. So we do have that on standby.
Is there any other questions or concerns? Okay. Seeing none. Well, thank you so much.
Okay, and please don't hesitate to call any of us, okay? Don't hesitate to call me. Don't hesitate to call Rudy. I mean, I know that we want you to have the latest information. You know, if you're hearing from schools, you know, police chiefs, I mean, I know there's a lot of concern about, you know, the problem with the opening up of 1B is that the regimented system of order got a little bit scrambled up. So, you know, we want to, you know, make sure that people, you know, feel that we're attentive to their needs. So please let us know if you have any questions or concerns.
Excellent. Thank you so much.
Thank you.
Have a good day.
Thanks.
Alrighty, moving on to our next agenda item. We have the Clerk Register of Deeds 2021 Survey and Remonumentation Grant Acceptance. We need a motion. Moved by Commissioner Lubes, second by Commissioner Gershenson. Is there any questions and items up for discussion? I'd like to bring forth Lisa Brown.
Thank you, Madam Chair.
Good morning.
Good morning. Thank you for taking this up. This is an annual grant that we have had for years. And just to give a little background, so remonumentation is done by surveyors. This is through the Register of Deeds office. We contract a handful of surveyors. They all kind of have their own area for the most part. And where this money comes from is when someone records something, I'm just going to give like a broad background, but when someone records something in the Register of Deeds office, we have a flat fee that is set in statute. It's $30. So $4 of every recording fee is set aside and put into the remonumentation fund, which is at the state level. The state then redistributes those funds to various counties. We have been in this mode for a number of years as far as doing our remonumentation. Other counties, so not everybody's doing it at the same time, but we are a donor county. So we get money back, but we give a lot more than we get back because we're so big and we have, you know, we have so many recordings. this is, after this year, we will go into maintenance mode. So we will still be receiving grant money, but it will be a smaller amount of money. And just for, I don't know, information purposes, starting January 2023, it will go down from $4 to $2 unless the legislature changes that. So, and then remonumentation. So what it is, like I said, it's for surveying, and I'm not going to get into all the different vocabulary and everything, but it's going out and marking these certain parts in property, and so that property lines are where they're supposed to be and all that sort of thing. And monumentation started in the 1800s, and I'll stop there if anybody has any questions or if Ron wants to add anything.
What does the county get for the grant funding? So the $322,165. Can you just explain a little bit of the expenses with that?
Sure. So, so if you see, like on the, I think on the resolution itself, it has the different line items that it goes to, and the per diem fee. We have, well, in normal times, our surveyors would meet usually every month on a Tuesday evening in my office, in the Register of Deeds office, and that's peer review. So they would get paid for their time, because not everyone who came to that actually does the remonumentation. Not all of them actually do our surveying. Sometimes they're just there to like give feedback and that sort of thing, which I've sat in on them. It's kind of interesting, but if you're into that sort of thing. So we have, like I said, a handful of surveyors who that's who we're paying. That's where the majority of the money goes. Ron Crank, who I'm sure most of you have met at least through this process, who works in the Register of Deeds office, and he will be helping, just as a side note, he'll be helping with the maps for redistricting. But anyways, and he helps with the map because of elections and everything else. So part of his salary is also paid out of this because part of his time is spent on this. But otherwise, we're paying the surveyors that we contract with to do all the work out there in the field.
Excellent, thank you.
And
Is there
and
any other-
I think attached is the plan that has to be put together as to how many corners we plan on doing each year, and that sort of thing. So, I mean, it's been a checklist of going through the county and making sure every monument has been, addressed, throughout these years. So like last year, I think we were supposed to do 74 and they ended up being able to do 75, which was great. I know the year before that, we did a little bit more than like we originally said. So sometimes our plan changes a little bit if our surveyors and everything have the ability to do more.
Sure. Well, thank you. Is there any other further discussion on item number 2 of our regular agenda? Alrighty. Well, thank you so much, Elisa. I appreciate the update on this. Hearing none, can we get a roll call, please?
Sure. Commissioners Gershenson,
Yes.
Luce,
Yes.
Juliet,
Yes.
Nelson.
Yes.
Madam Chair, you have 4 yeas, 0 nays.
Thank you.
Thank you.
Thank you so much.
Thank you. Thank you.
Alrighty, moving up next on item number 3 of our regular agenda, miscellaneous resolution 21001, Board of Commissioners, designation of January 11th, 2021 as National Human Trafficking Awareness Day in January 2021. And you know what? I made a mistake. That is not the next item on our agenda. I apologize. Item number 3 is the Parks and Recreation Commission approval of amendment number 1 to Fair Food Network 2020 Grant Board Agreement for the Double Up Food Bucks program. We need a motion. A motion by Commissioner Joliet, second by Commissioner Gershenson. Welcome, Melissa.
Good morning again, everyone. So this is a amendment to the agreement that we have with the Fair Food Network for fiscal year 2020. For those who might not be familiar, this is a program that we've been running at the market for several years now, and it is very popular with our market participants, and we're really happy to be able to participate and provide this service. And what it does is allows customers that are using SNAP benefits to buy their fresh produce to essentially double that through this program. So they can double it up to, I think, $20 worth of additional fresh produce every market day. This year, we did see a big uptick in people utilizing their SNAP benefits for fresh produce. We assume that is largely due to the pandemic. So we did serve more people, and we did run out of money and overspent a little bit. So the Fair Food Network was kind of aware of the situation that we were in and knew that that was the trend, the way that we were trending. So they're amending our agreement for this year to provide us an additional $5,000, which will make us whole for 2020 and then get us started for 2021. We do expect the grant agreement for 21 to arrive any day, so you'll likely see that in the relatively near future as well.
Excellent. I noticed that we didn't distribute any tokens in 2020. Was this due to the pandemic?
So the tokens is different than the actual cash itself. That's just the physical tokens. So if we need more, they give us additional tokens. We just didn't need any more for 2020 because we reuse them every year.
I see. Thank you. Commissioner Gershenson.
Thank you. Melissa, given the pandemic, I just want to be sure that we have enough money. So right now we have approximately $19,000 waiting to, right? So that's for 2021.
No, the 19,000 was the total for 2020. So we're always a few months behind with this program because our market runs continually all year long, and the program really kicks off in the spring. So we do expect somewhere around the same amount of money that we spent this year to come in for 2020. I would expect it to be somewhere between $15,000 and $20,000, knowing that if we do look like we're going to overrun again, the Fair Food Network will amend the agreement again to provide it.
Okay, so it isn't a question of us adding more money to it. You have a source that's going to take care of it.
Yeah, the money all comes from the USDA through the Fair Food Network.
Okay, thank you.
Yeah.
Excellent. Is there any other discussion on this agenda item? Okay. Well, I would just like to say, Melissa, what a great initiative. I mean, Double Up is a great way for people to afford more fresh fruits and vegetables. So thank you so much for providing us with this information. And if there's no further questions, roll call, please.
And item 3, Commissioners Loops,
Yes.
Joliet,
Yes.
Gershenson,
Yes.
Nelson.
Yes.
Madam Chair, you have 4 yeas, 0 nays.
Excellent. Thank you. Thank you so much, Melissa.
Thank you.
Next up on our regular agenda is item number 4, which is the miscellaneous resolution 21001, the designation of January 11th, 2021 as National Human Trafficking Awareness Day and January 2021 as Slavery and Human Trafficking Prevention Month here in Oakland County. May I have a motion? Motion by Commissioner Lubes, support by Commissioner Joliet. And I believe Commissioner Gershenson was going to speak on behalf of this due to Commissioner Jackson being absent.
Right. And I also want to acknowledge Commissioner Spiz has been very involved in this initiative as well, and that we actually have a human trafficking task force for Commissioner Joliet to learn about. And I was just stunned when I read this resolution that it's estimated that 100 to 300,000 American children can be affected by trafficking. I believe yesterday was the anniversary. Yesterday was the actual official day commemorating this important initiative. It's easily something that we don't really want to think about and that we don't think affects our affluent Oakland County, and it does. So I'm really grateful to Commissioner Jackson and Spiz for bringing this forward. and look forward to us continuing to champion this and staying involved in the task force.
Thank you, Marcia. Is there any other questions for item number 4? Okay. Seeing none, roll call, please.
On item number 4, Commissioners Joliet,
Yes.
Gershenson,
Yes.
Loops,
Yes.
Nelson,
Yes.
Madam Chair, you have 4 yeas, 0 nays.
Thank you. Next up on our regular agenda is item number 5, the Board of Commissioners dedication and naming of the Oakland County Elections Division Training Room to the Willis C. Bill Bullard Jr. Conference Room. I need a motion by Commissioner Loops, support by Commissioner Gershenson. At this time, I'd like to bring, I believe, Chairman Woodward is here with us on the call today.
He's on mute.
Chairman Woodward, if you are here, we cannot hear you. Commissioner Gershenson?
Well, I'll certainly fill some time because I was lucky enough to serve with Bill Bullard, and what a great, fun, great guy he was. When I first came on, he was chair, and he really exemplified what a good chairman should be. He listened to the minority caucus. He included us in every decision that we could be involved in. And I was continue a friendship with him after he left the commission. And I'm really excited about this. He was just one of those larger than life kind of guys, and was really saddened. It really is a loss to our community.
Thank you. Good morning, Chairman Woodward.
You moved much faster through this agenda than I planned. I put a mark on the calendar, so I think it was all set. So I just wanted, I told you I'd be here, and I was here in the background, but I was on a call. But I don't know if there's any additional questions that that folks have. But I mean, I think this is a way to pay tribute and honor to a leader of our caucus, a leader of our board. And while I can speak for myself, I mean, while we disagree on a lot of particular political issues, moving this county forward, moving this board forward was always a shared priority. So.
Chairman Woodward, can you just give us an idea of the scope of work that is going to come from this resolution in regards to what exactly we are going to do?
Sure. And staff, I mean, feel free to, I mean, if I state anything incorrectly here. I mean, I think the general idea is to put a plaque on the wall of the education training room in the elections office. I mean, this is one of the that whole project of where the elections department is for newer members. It's, I mean, the only thing you've ever seen of the elections office. Older members, you remember where it used to be. So now we made that happen, but I built that training space, and the operations of of elections and the training of workers, and now one of the locations of the absentee counting boards that is done. All of that, I mean, happens in that space. And so the idea is to put a commemorative plaque to name that training space over an election after Bill Bullard training room, and just to purchase the plaque. So I know in the resolution, it's got a much bigger mark. And I might have missed this, Madam Chair, if you would explain. I think staff looked to the last time we did a name and commemorative, and they just lifted that language off and placed it here. It is by no means going to be anywhere near that amount. I don't know if we have, I mean, if people want to lower the amount, that's fine, but all the intention is to put up, and staff will be directed to help fund and put up a commemorative plaque with designating the election worker training room as the Bill Bullard training room.
Excellent, thank you. Commissioner Joliet?
Just a quick question, and I don't know if this is answerable just because of the pandemic, but is there a turnaround time the time frame that this is supposed to be done in? Or predicted that it'll be done by?
I don't have a time frame because I think we're going to look to using internal staff and facilities to help. I mean, so work around the labor schedule there. Obviously, whatever time it takes to order the plaque and staff. I don't know if we've gotten that far yet, or we're waiting until after the resolution to figure that out. But I think we can get a better sense of that, even probably between now and the board meeting. What would it take and how long would it take to order the sign? I think once we have it, putting it up, we're talking days.
Okay, thank you.
Thank you. Is there any other further discussion? Commissioner Gershenson?
Yes, Chairman, can we request that we be notified when it is going to be hung, or if there is going to be any sort of ceremony around it, that we can all be invited?
Sure. Yep. I'll make sure that staff knows about that. There is a resolution posthumously being written for Bill Bullard. I know Commissioner Gingell has started that process, and I believe there is I'll call it the funeral, but I think it's more of I don't know if it's a funeral or a viewing or some sort of gathering to celebrating his life that's happening shortly after our next board meeting. So and I want to thank the chairwoman for putting this on the agenda so promptly. I think one of the things at that we want to make mention of, so we'll make sure that all commissioners know about that event that's at end of January, and we'll make sure that when the unveiling happens, all commissioners who would like to attend it will be invited to do so.
Excellent, thank you. Is there any other further discussion on item number 5 of the agenda? Commissioner Gershenson?
I'm sorry to be such a pain this morning, but
Absolutely.
I think that the tribute to Bill Bullard is Saturday, the 16th.
Is it the 16th?
I believe so. Definitely double check me, but just so everybody will hear about it before the next board meeting.
Sure, I will. I thought it was the 20s.
There also is on the 23rd. There is a memorial service to Bill Bullard.
Okay, that's what I'm thinking of. Okay.
Perfect.
So
Is there any other?
Can you make sure that everyone gets the memorial service information? I don't know if the 16th. I don't know if the 16th is a more private family thing. That one's not on my calendar.
Correct. We could resend what Chris had previously sent out before. Yep, absolutely.
Excellent. Is there any other further discussion on item number 5? Okay, hearing none. Roll call, please.
On item number 5, Commissioners Gershenson,
Yes.
Luce,
Yes.
Joliet,
Yes.
Nelson.
Yes.
Madam Chair, you have 4 yeas, 0 nays.
Thank you. Moving on to our last item on the agenda, item number 6, urging the Centers for Disease Control and Prevention to increase Michigan and Oakland County's COVID-19 vaccine supply. Moved by Commissioner Luce and support by Commissioner Gershenson. As the sponsor of this resolution, I can speak on behalf of this. I think we all heard this morning from Deputy Chambers in regards to where we're at right now with our vaccines. And the bottom line is that we need more vaccines to meet the demand, and not just here in Oakland County, but across our state. Presently, what's happening here in Oakland County, that the number of appointments available is limited to the number of doses that we've received from the state. And with the governor expanding the phases to allow for more priority groups to access the vaccine, it's created an even bigger strain. And because we don't have enough vaccines already for those phases that we've presently opened up, it's a big problem. And it's really important that we do act quickly, because obviously there's multiple different variables that come into play. Some of the more important ones are, with the new virus variant, possibly Michigan, the potential for post-holiday increase in cases, and the need to reduce the pressure on our healthcare system. It's essential that we get more vaccines out to not just Oakland County, but across the state. Is there any other questions, discussion on item number 6? Commissioner Gershenson.
Well, I just want to thank you for bringing this forward. And I know that Executive Coulter wrote a letter to the governor. There is tremendous frustration out there. And with the opening of the second tier, I'm getting a lot of calls, and I would imagine that most commissioners are. So I really appreciate everything everyone has done, and Deputy Chambers coming to talk to us this morning. I think that was really critical so that we have some information, because we're all frustrated too. We can't make excuses for it. It is what it is, but it's good to be armed with the knowledge of where the backlog is. Thank you.
Absolutely. Thank you, Commissioner Gershenson. As you mentioned earlier, I know I've received a lot of calls from constituents over the past couple days in regards to the vaccines. So I'm just, as you reiterated as well, we're doing the best we can with what we have, and there is no intent to look at it as a blame game. The bottom line is Center for Disease Control and the federal government is the main person and main entity that is distributing out the vaccines to the state. So I'm hopeful that as we do move along over the next couple days and into the week, that we will have better insight into what we could further anticipate as far as the number of vaccines. Is there any other further discussion on item number 6? Hearing none, roll call, please.
On item number 6, Commissioners Lutz,
Yes.
Joliet,
Yes.
Gershenson,
Yes.
Nelson.
Yes.
Madam Chair, you have 4 yeas, 0 nays.
Excellent. Well, I appreciate that. Thank you. All right, moving on to our agenda. Is there any other business to come before the Legislative Affairs and Government Operation Committee?